Hello and welcome to Pet Living. Our topic today is canine noise aversion, and Dr. Lisa Radosta of Florida Veterinary Behavior Service joins me for a short Q&A. Dr. Radosta is a board-certified veterinary behaviorist with extensive experience treating dogs with noise aversion. Welcome, Dr. Radosta.
Thank you. As the sky gets cloudy in South Florida, we're getting ready for a thunderstorm.
That is for sure. So first question is, how do I know if my dog has noise aversion?
I love that question because many pet parents overlook noise aversion inadvertently. Your pet during a thunderstorm, construction, walk outside where he hears a big truck, he should act the same. His emotional state should be the same as it is when those stimuli aren't present. If his emotional state is different, your eyes should be focused on that dog. Look to see if he's trembling, if he hides, if he comes to find you and he wouldn't normally do that, if he self-isolates from you and doesn't come out for an hour or half an hour, however long it is. That dog has some type of noise aversion. Noise aversion is going to cover noise fear, noise anxiety, and noise phobia. We're going to put it all under that umbrella of noise aversion. And I want to make sure that the pet parents hear me when I say, if your dog's emotional state changes, you have to act. You have to do something.
Very important. Yes. What is going on inside his or her brain?
What's going on is a cascade of neurochemicals that alter not just the brain neurochemistry, but the hormonal balance, the blood glucose balance, all throughout the body. So noise aversion causes that to start in the brain, affects the entire body, and over the long term, that affects health of the patient. So immune system, ability to fight off infections. We really want to make sure we're tackling that stress head on.
How would I get my dog help for noise fear, noise phobia, noise anxiety?
Yeah, I like for people to go back to their vet first, and I want you to advocate for your pet. I want you to say, I want a good physical exam, not that your vet would do a good one, but we're not going to usually do an orthopedic exam unless we have a reason to do that. So I'm going to ask for a full exam, orthopedic, neurologic, make sure my dog is okay. I might even ask for screening lab work or urinalysis, just depending on what my dog's signs are. From there, you may get the help you need right from your vet. There may be a medication that your vet gives you. You can go onto our website, flvetbehavior.com, for noise phobia information. You can go to Dog Nerds for the noise phobia course. I mean, there's a lot of things you can do to get help. You may work with a positive reinforcement trainer in your area because noise aversion requires, really to do it well, it requires behavioral treatments, not just medication. And finally, your veterinarian might refer you to someone like me, a veterinary behaviorist, and you can find one at dacvb.org.
Great. Is it ever possible that our dogs could get over their fear or their anxiety around loud noises?
Sure. Yeah. So my own dog came to me with a little bit of nervousness when we walked on busy roads. So I did start to do some work with him, and I did some counter conditioning, giving food to him as we walked on busy roads. He loves to eat, and he got through that. It was very soon after adoption I noticed it. He's about 6.5 months, and it went away very quickly. Dogs can get through it. Now, what would have happened if I didn't do anything? That's what I don't know. Can dogs grow out of it? Nah, they're not going to grow out of it. It usually starts young, and I don't see those patients, or let me say, just studies show us that veterinary behaviorists don't see those patients until they're 3, 4, 5, 6 years old. But they usually, with discussion with the pet parent, it started as a younger dog. So they're not going to grow out of it.
So as early as you notice those signs, you should talk to your veterinarian.
Do something, talk to your vet, because if you fix it then, you can actually fix it. It could go away like it did with my dog.
Terrific. Yeah. All right. And then lastly, what products or medications do you commonly recommend for your patients with noise aversion?
We have so many things for noise aversion because about 50% of dogs have it. So a lot of companies are looking at producing products. So we have pheromones, which you can plug in. This is the Adapto product, right? You can wear it on a collar, whatever you like. We also have supplements. We have Zealkine and Soloquin. We have medications, so we have as needed medications versus antidepressants, there's really, I want people to hear you haven't done it all. There's always more you can do. There's help for your dog, because people really come in feeling wiped out.
Desperate.
And desperate. Yeah. You know this. You know what this feels like.
I've been there.
Yeah.
Excellent. Well, thank you so much for your time, Dr. Radosta. And once again, can you just remind folks where they should go for more information?
They can go to flvetbehavior.com. They can go to dacvb.org, and they can also go to therealdognerds.com.
Fantastic. Thanks so much for your time today.